Hi, I'm Dr. Liz Lyster. I wanted to give just a few comments on the recent roundtable that was convened by the new FDA commissioner, Dr. Marty Makary. He's a little bit of a controversial person because he is really more on the side of functional preventive medicine. So that's not precisely the whole mainstream, although he is a surgeon. So he's an interesting person just on his own. However, I really liked the roundtable. There's a link to it that you'll see along with my comments. Few very, very important points were brought up. They had quite a few speakers. They did a good job timing them. They were allowed one slide each, but they really crammed a lot of information onto their one slide. So that was pretty creative and a little bit of humor at the end about that. I think almost every single woman that was on the panel, quite a few doctors of different specialties, women I've either met or I read their material or I have followed them for a long time, and then a couple of them who I've met in person. And then there were a few different male doctors, a lot of whom were new for me, but they also made really excellent points. There were three major points that were very, very important that I just want to touch on briefly with you. And the first one is removing the black box warning from estrogen products. This is especially important for vaginal estrogen, which I'll say more about in a moment. So this is something that I have talked about with patients, and I have never had a patient, after I reassure them of the reason that black box warning was put on there, I've never had anybody not then used the product when they got home and read that. I always warn people about all the scary things in the prescribing information, the PI, that giant sheet of newspaper print, thin paper with every single possible side effect that could happen. I usually just don't look at those because they have there's a lot of problematic issues of what actually ends up on that list. But in any case, the black box warning is very frightening. Very, very frightening that estrogen will give a woman cancer, either of the uterus or of the breast. And we now know, this data is so old, so outdated. We know that estrogen lowers the risk of breast cancer. Now, in a woman who has her uterus, estrogen given alone can increase the chances of uterine cancer. That was discovered about 50 years ago, or a little more, I think. And right afterwards was discovered that when you use a progestin or progesterone with the estrogen, you negate that risk. Okay, so this very scary warning really, really needs to come off of estrogen products. In particular, it scares women away from using vaginal estrogen. Vaginal estrogen is really important. It's so important. The more I learn, the more impressed I am, because it doesn't only treat the lining of the vagina, it also treats the base of the bladder. One of the panelists, Dr. Rachel Rubin, she is very passionate about this and talks about this a lot when she's interviewed, that if women in their later years, let's say 70s, 80s, were given vaginal estrogen as a routine, it would save billions of dollars of complications from urinary tract infections. Okay. We also have very abundant, very clear data that it's perfectly fine to do even after hormonal-based cancers. I always talk about this with my patients in conjunction with all of their healthcare team. Right? So she needs to also have her oncologist involved, but a lot of doctors, a lot of oncologists are getting with the program that the genitourinary syndrome of menopause, as it's referred to, which is not just dryness, it is a loss of elasticity of the tissues, including of the bladder, that could be saved if women were simply given vaginal estrogen to use. It's extremely low dose. It comes as a cream or a tablet, FDA approved in various forms, often covered on insurance, not always, but usually, and just really honestly can be life-saving. Then the other very important topic that was covered, especially by Dr. Kelly Casperson, who I follow her work and I really like her work. She talked about another important topic that I also talk about with pretty much every single one of my patients. And that is, at this time in the United States, women do not have an FDA-approved form of testosterone. And so I work with my patients and I work with compounding pharmacies. I think compounding pharmacies are excellent. I could talk about that another time. They are not, most of them are not monitored by the FDA, but they are monitored by the pharmacy board. All right, so they are not without monitoring. Again, topic for another video, another time. However, testosterone is an amazing hormone for women. It does help with quality of life. It helps with mental stability. It helps with bone. It helps with muscle. It helps with metabolism, right? And so some doctors are using the products that are out there for men, like the topical gels, using them off-label for women. I prefer to use compounded products, but nonetheless, the point still stands that testosterone, we women actually have more testosterone in our bodies than we do estrogen. The way they do the units in the measuring is interesting. And so, but when you look at the actual quantity, it's actually a higher amount of testosterone in our bodies. Of course, about a 20th of what men have in their bodies. But in any case, we really, really are overdue. There was a product that went off the market, not due to safety, due to economics. The company went out of business. It was around maybe 20 years ago. It was an oral estrogen, which we don't like, combined with testosterone. And there are pharmaceutical testosterone products for women in other countries like Canada, in Europe. So it is way past time that we have something like that here in the United States. If you are really interested, give it a listen. It is primarily, I think, speaking to doctors, but not everybody there was a medical doctor. And so I really feel that the panelists did a great job with summarizing the important data and making these really, really important points, including many, many other points, things that I've talked about in other videos, the benefits of hormones. And so if you would like, you can give it a listen. Thank you for listening to these little highlights, little comments from me, a little bit of feedback. We'll link to the full video. Take care and see you soon.